Well, if you have a family member or friend in a nursing home right now, it may be easier to see them on your next visit. The State Department of Health just handed down new guidelines, rolling back some of the COVID-19 requirements to come inside those nursing home facilities. Alex Love went through the paperwork. He joins us now in the newsroom with more on these key changes. Alex.
Well, Adam, with this new announcement, the New York State Department of Health is aligning their policies with the Centers for Medicare and Medicaid Services regarding screening and testing for anyone coming into nursing home facilities. Going forward, nursing homes are no longer required to make visitors show proof of a negative COVID-19 test before they enter or conduct active COVID-19 screening upon entry, meaning it's no longer mandatory to have all visitors fill out a questionnaire or participate in a one-on-one interview to determine if they're showing any kinds of COVID-19 symptoms or came in close contact with a positive case. Visitors also do not have to have their temperatures taken when they come in. Nursing homes are still allowed to voluntarily keep this type of process in place to enter if administrators believe it's necessary, and the state encourages anyone who visits one to get tested on their own beforehand, especially if you live in a county with high levels of community transmission per CDC standards. Now, in a statement to News 8, St. John's Nursing Home said they're reviewing their current guidelines, saying, quote, "We will release new information regarding policy changes at St. John's Home and St. John's Penfield Green Homes once a decision has been made impacting residents and families," end quote. Now, the latest data from the CDC labels every county in the greater Rochester area only having medium levels of COVID-19 transmission. Anyone who's positive or has close contact with a COVID-19 case should still postpone any visits to nursing homes for at least 10 days as precaution for residents. Adam?
Alex, thank you. CDC recommendations still include masking up while you're inside any type of senior living home. For more details on this announcement from the state, visit rochesterfirst.com.